Good evening, everybody. Thanks for joining us. Our apologies, we've had another long day in the House, and so that's why we're starting a little bit late here this evening, but I'd like to call this meeting of the Standing Committee on Accountability and Oversight to order. My name is Kevin O'Reilly. I'm the MLA for Frame Lake and chair of the committee. This evening, committee will receive a public presentation from the Honourable Carolyn Cochrane, Premier, the Honourable Julie Green, Minister of Health and Social Services, and Dr. Kandola, Chief Public Health Officer. I understand there's a number of other officials that are joining us as well. Today's meeting is being live streamed on the Assembly's social media channels. To respect physical distancing requirements, our witnesses will be attending remotely by video conference. I'd like to remind all members and our witnesses that all comments, questions, and remarks will need to be directed through myself as chair. Both members and witnesses will need to wait to be recognized by the chair before speaking. I'll now ask members to introduce themselves for the record, and I'm going to start on my left with MLA Johnson.
Rylan Johnson, I'm the MLA for Yellowknife North.
Katrina Knockleby, MLA for Great Slave.
Caitlin Cleveland, Cam Lake.
Lisa Semler, MLA for Nunavut Twin Lakes.
Rita Martzellos, MLA for Tabacha.
Rocky Simpson, Hay River South.
And I believe we have one MLA joining us by phone as well.
Yeah, thank you, Mr. Chair. Jackie Jacobson, MLA Nunavut.
Thanks, everybody. And we have some of our staff in the room, the committee clerk, Mr. Ball, and our research advisor, Mr. Dunbar, and our research intern, Mr. Thomas, as well. I'll now invite the Premier to proceed with any opening comments that she may have.
Thank you, Mr. Chair. You can hear me fine?
Yes, please go ahead.
Okay, thank you, Mr. Chair. Thank you, everyone, for the opportunity to be here this evening to provide an update on COVID-19 in the Northwest Territories. With me here tonight is Ms. Julie Green, the Minister of Health and Social Services, and Dr. Kandola, the Chief Public Health Officer of the Northwest Territories. Also in attendance are Bruce Cooper, the Deputy Minister of Health and Social Services, Russ Nudoff, the Associate Deputy Minister responsible for the COVID-19 Coordinating Secretariat, and Dr. Andy Delapisi, Deputy Chief Public Health Officer for the Northwest Territories. As well, Charlene Woodruff, our Principal Secretary, is here, and officials from Health and Social Services and perhaps the Secretariat. Mr. Chair, since the pandemic was declared in March 2020, our collective efforts to limit the spread of COVID-19 in the Northwest Territories has proven to be an overall success. Compared to other jurisdictions across the country, we have kept our numbers relatively low, have managed one community outbreak and 3 outbreaks at remote mine sites that could have easily been worse than they were, and have led one of the most successful vaccination campaigns in Canada. The strength and resilience of our communities and residents across the territory has played an important part in our pandemic response. This is particularly notable when talking about the NJ Macpherson school cluster in Yellowknife. Safety and preparedness has been our top priorities since the pandemic began, and the response to contain this outbreak is an example of the hard work of so many to protect residents and communities. This includes our dedicated healthcare workers who did the contact tracing and testing, the lab workers who worked numerous hours to produce over 3,600 tests, and the families and individuals who followed the public health isolation guidance given to them, sometimes for an extended period of time. Because this cluster impacted our youngest residents, the government worked diligently to secure doses of the Pfizer vaccine to begin administering to those aged 12 to 17. Minister Green will talk more about that in her opening remarks. Since the first case was confirmed at NJ School, a tremendous amount of work has gone on behind the scenes to understand the extent of the spread and to contain it as quickly as possible. Because of this hard work by our Chief Public Health Officer and her team, and by the many others involved, including the Northwest Territories Health and Social Services Authority, the COVID Secretariat, Education, Culture and Employment, the school boards, along with residents and businesses, we were able to prevent community transmission in Yellowknife and surrounding areas. Every person, Mr. Chair, who gets vaccinated plays an important part in our effort to beat COVID-19. Every vaccinated resident helps to protect the health and well-being of our communities and our loved ones. It will help us get back to doing the things that we love, and the more Northerners that get vaccinated, the more we can ease public health measures. Please, everyone out there, get vaccinated. Let's keep doing our part. On that, Mr. Chair, with your permission, I'd like to turn it over to Minister Green to provide her opening remarks. Thank you, Mr. Chair.
Thanks, Madam Premier. Minister Green, please go ahead.
Yeah, thank you. Good evening, Mr. Chair, and good evening, colleagues and members of the Standing Committee on Accountability and Oversight. Thank you for this opportunity to update you on the GNWT's response to COVID-19. Almost 15 months into this pandemic, we find ourselves as a territory and a country at a turning point. Most jurisdictions across Canada are seeing their COVID-19 case counts and hospitalizations start to drop. Approximately 60% of Canada's population has received their first dose of a vaccine, a COVID vaccine. In the NWT, we are emerging from our first community-wide outbreak here in Yellowknife, based at the NJ Macpherson School. I know that you'll have questions about our response to this outbreak during this briefing, and we are here to answer them. I can say that through our actions and thanks to the efforts of families and individuals impacted by the outbreak who followed public health guidance under challenging circumstances, together we contained the outbreak and didn't have to go into a long lockdown situation here in Yellowknife or in Detta, Dilo, or Betchco. This was no easy achievement. As we put this outbreak behind us, we are now preparing to release an updated Emerging Wisely plan, our guide to easing public health measures gradually and safely. Residents will notice some differences between this updated Emerging Wisely plan and the one that was first released in April of 2020. It will move away from the original phased approach and will have a strong focus on personal risk mitigation and guidance. Each of us will need to identify the risks in our current environment and determine the best way to mitigate them so we can continue to keep ourselves and our communities safe. I'm confident NWT residents will rise to this latest challenge, as they have since the beginning of the COVID-19 pandemic. It's been through our collective efforts that we've been successful, at keeping COVID-19 cases low so far. That will continue to be the case. Collective action from healthcare providers, residents, and businesses will help us stay on track. Mr. Chair, I'm going to end my remarks here and turn it over to Dr. Kandola, the Chief Public Health Officer, to take us through the presentation on our COVID-19 response. Thank you.
Thank you very much, Minister Green. Dr. Kandola, do you have any opening remarks, or are you heading straight into your presentation?
I'll be heading straight into the presentation so that we'll have more time for questions.
Yeah, please go ahead then. Thank you.
So good evening, everyone. I am Dr. Kandola, Chief Public Health Officer of the Northwest Territories. Today I'm joined by Dr. Andy Delipisi, Deputy Chief Public Health Officer, and Dr. Anne-Marie Pegg, our Territorial Medical Director. Next slide. Today I will provide a short update on the current COVID-19 situation globally, in Canada, and here in the Northwest Territories. I will then give a brief update on the updated Emerging Wisely plan. And then Dr. Delipisi will then provide an update, an overview of the NJ Macpherson school outbreak, and then we will take your questions. Next slide, please. Next slide. So when you look at the global situation, The number of new cases and deaths are decreasing, but there's still a high incidence of COVID-19 globally. There were over 3.3 million cases in the past week and 73,000 deaths. This represented an 11% decrease in cases, 60% decrease in cases, and 11% decrease in deaths compared to the previous week. The highest number of new cases were reported in India, with over 1.1 million new cases, followed by Brazil with approximately 450,000 cases, and Argentina with 237,000 cases. In the United States, there are still well over 116,000 new cases, and that's despite the ongoing and successful rollout of the COVID-19 vaccine in that country. Variants of concern continue to increase around the world. On May 11, the World Health Organization classified the variant first found in India as the B.1.617, and that became a variant of concern. This is the fourth variant strain of COVID-19 with this designation. All four variants are shown to be more transmissible and possibly result in more severe disease. There also has been a new variant detected in Vietnam, which appears to be a hybrid of two highly transmissible strains, the B.1.617 and the B.1.1.7 first found in the UK. Next slide, please. In Canada, we have had approximately 1.39 million cases of COVID-19 with about 25,600 deaths. Fortunately, we are seeing a steady decline in the total number of cases across the country. The daily number of cases have dropped to about 2,000 from a high of over 9,000 in April. In fact, Dr. Teresa Tam, Canada's Chief Public Health Officer, stated on May 28 that we are well and truly over the peak of the third wave. This can be attributed to the success of the vaccine rollout. Close to 60% of the Canadian population have received their first dose. It's also attributed to effective public health measures and restrictions on gatherings and activities that were instituted throughout Canada by various provinces. Despite this positive news, there still continues to be challenges in some areas of the country. In Manitoba, the number of patients admitted to intensive care has put a strain on the healthcare system. In fact, in one 48-hour period, there are over 30 COVID-19 patients admitted to intensive care. And since mid-May, Manitoba had to transfer 39 patients out of the province for critical care. Manitoba has the highest rate of active cases in Canada. In fact, it is 4 times the national average. And sadly, today, 2 patients have died thus far during transport out of Manitoba to other areas of care. Next slide, please. In the Northwest Territories, we are now down to 4 active cases of COVID-19, 3 at the Caddy Diamond Mine and 1 recently at the Diavik Diamond Mine. The last active cases associated with the NJ Macpherson school outbreak recovered on June 1st. There's a new outbreak at the Caddy Diamond Mine. The latest cases at the mines and the NJ Macpherson outbreak are reminders that even with a good vaccine rollout, COVID-19 is not done with the Northwest Territories, and we still need to maintain measures to account for importation and prevent transmission. Next slide, please. I wanted to first provide a bit of a breakdown of the role between the Office of the Chief Public Health Officer and the Northwest Territories Health and Social Services Authority. CPHO has been delegated authority by the Minister of Health under the NWT Public Health Act to allow implementation of measures to protect public health. As such, the Chief Public Health Officer provides clinical public health direction to the Health and Social Service authorities for responding to pandemic COVID-19 in the Northwest Territories. The CPHO creates public health orders and communicates to the public with the support of the COVID Secretariat and NTHSSA. Under the NWT Public Health Act, CPHO provides clinical direction to health and social service providers in response to a public health threat. Senior management and clinical leadership within the health and social service authorities are responsible for ensuring staff implement this direction and are supported to meet surveillance, diagnosis, treatment, and reporting requirements as legislated under the Public Health Act and its applicable regulations. The authorities also collaborate with the Department of Health and Social Services in disseminating information and education to the public. COVID Secretariat role is to support the implementation of public health orders. Secretariat supports our office in terms of communication. It provides information to the public through the Protect NWT 811 service and provides compliance and enforcement. Secretariat also receives and processes self-isolation plans and manages the territory's isolation centers, ensuring that everyone entering the Northwest Territories has the means to safely self-isolate. Next slide, please. As of May 29, we have administered 53,501 doses of COVID-19 vaccine. 29,579 first doses and 23,922 second doses. Of these, 1,594 are Pfizer doses, recently being rolled out to children aged 12 to 17. The vaccine coverage up until May 31st of NWT residents aged 18 and over is 68% for those who have received at least one dose, and approximately 61% for those who have received both doses. This coverage reflects those with a valid NWT healthcare card or those who've had an expired healthcare card in the last 2 years. Currently, these coverage rates do not include Pfizer vaccine doses administered to youth under the age of 18. But this will be amended soon to include this. So overall, NWT vaccine uptake matters. It will be an important measure as part of relaxing restrictions under Emerging Wisely. And we have seen lower uptake in the Cochrane and Stockton regions, and we are making efforts to help address this lower uptake. And I'll discuss this further in the next slide. Next slide. So we are working to address vaccine hesitancy and increase uptake in a number of ways. Direct one-on-one conversations with community members have been most beneficial. A social marketing team lead on the ground outreach have used pop-up information booths, door-to-door campaigns, and walk-in clinics at high-traffic locations like grocery and retail stores, with the most successful being at the local Walmart and Canadian Tire during peak weekend hours. Direct calls from frontline healthcare workers to clients proved effective for booking appointments for first and second doses and were received very positively, with 68% of people who answered a call directly from a healthcare worker either booking an appointment on the spot or committing to getting vaccinated at a later date. During these calls and pop-up clinics, staff continue to educate residents directly about COVID-19 disease and about the vaccine, and to identify and address any trends in misinformation or barriers to access. Both myself, Dr. Anne-Marie Pegg, have made regular appearances on local and broadcast radio, including call-in and Indigenous language shows, to promote the vaccine. And recently, Dr. Pegg also participated in a videotaped question and answer session with young people as we rolled out the vaccine in this population. Speech bubbles with catchy sayings are posted on the walls of our vaccine clinics to encourage photo taking and posting to social media. Pins given out at vaccine clinics saying, "I got the COVID vaccine," have been very popular, as they are in all 11 of our official languages. We're also working with the NWT Association of Communities to roll out $100,000 of funding for actions to support vaccine uptake at the community level through the Community Vaccine Promotion Fund. The COVID Secretariat is working with communities, all regions of the Northwest Territories, on a social media campaign to promote vaccine uptake. This involves community leaders and community influencers. There will continue to be a lot of work to improve vaccine uptake over the course of the summer. Next slide, please. So I'll now provide a brief update on the updated Emerging Wisely Plan. We are planning for a public release of the new updated Emerging Wisely Plan for June 9th. Public health measures like travel restrictions, self-isolation requirements, and rules for gathering and capacity limits have been put into place to mitigate the health impacts of COVID-19. These measures have been instrumental in the protection of the public. We know they have taken a toll on residents and businesses in the Northwest Territories. The goal has always been to remove restrictions slowly and safely. The review of Emerging Wisely will gradually lessen requirements, beginning first with outdoor activities and lower risk activities, towards easing restrictions on high risk activities. Beginning with outdoor activities means we'll be able to do things like folk on the rocks, farmer markets, larger barbecues, and other gatherings. As the risk begins to decrease and we meet some of the indicators, especially higher vaccine uptake, we will be in a better position to relax restrictions on some of the high risk activities. We will also be reviewing the travel restrictions and isolation requirements. It will be important to maintain these protective measures and continue the behaviors we have successfully adopted even after vaccinations. We also want to help the public better understand how to assess, mitigate, and ultimately live with COVID-19 risk. The updated plan will better reflect the current situation in Canada with information not available in early 2020, such as vaccines and variants of concern. This new information will provide residents with information so they can determine how best to mitigate risk given our current environment. Overall coverage of vaccine in the Northwest Territories will be the key measure in determining on how to relax measures. It will be a straightforward indicator for relaxing restrictions. The updated Emerging Wisely Plan will remove the old phased approach and look at a new approach to review the risk within the territory and across Canada, and look at a measured transition to relax public health measures. The plan will also have a stronger focus on personal risk mitigation and guidance. I will now turn to our Deputy Chief Public Health Officer to provide an overview of the NJ Macpherson outbreak. Thank you.
Thanks, Dr. Kandola. Happy to turn it over to Dr. Del Pizzi. Please go ahead.
Thank you, Mr. Chair. Thank you, Premier Cochrane and Mr. Green and Dr. Kandola. So I was hoping to take about 5 or 10 minutes just to describe the NJ Macpherson outbreak and our collective response, especially in the first few days, and then review some important outcomes and some lessons learned too. So we think it's really important to communicate that a lot of planning and preparation was in place for a collective response to a community-based COVID outbreak in NWT. Importantly, our office developed a guidance document called COVID-19 Interim Public Health Disease Management for NWT, which is available publicly. We use information from the World Health Organization, Public Health Agency of Canada, other provinces and territories to develop standard definitions and NWT-specific approaches to determining if a person has COVID, or if they probably have COVID, or if they're a contact of COVID, or whether an outbreak exists. Standardized management flows from the standard definitions. For example, we feel it's really important to manage people who probably have COVID as if they truly have COVID. People who probably have COVID include those contacts that develop symptoms of COVID, or people who test positive on a point-of-care test, like an ID now. We recommend that probable cases isolate, and we perform a contact investigation and ask their contacts to isolate too. Because COVID transmits so efficiently in households, we've consistently recommended public health measures for households in NWT. We've recommended that household members of cases, contacts, and returning travelers should self-isolate or isolate during the pandemic as well. We provided guidance on managing vaccinated contacts to COVID-19 in the same way as unvaccinated contacts. We know COVID vaccines are highly effective. A vaccinated person has about 1/10 of the risk of developing COVID after an exposure compared to an unvaccinated person. In households where the risk of transmission might approach 30% with variants, for example, we expect vaccinated people living with someone with COVID might develop COVID about 3% of the time, and we felt that this risk was too high in our current situation. Our office also developed guidance document on managing COVID outbreaks in NWT schools and sent this to the Department of Education, Culture, and Employment in fall 2020. So when we received notification of a child who attends NJ having COVID, we responded with a standardized approach, and we worked with Yellowknife Public Health and school administrators. We performed a reverse contact investigation to try to determine the source of the infection. We performed routine contact tracing, and we arranged testing of contacts. By the end of the day on May 1st, the Department of Health and Social Services Emergency Operating Center stood up because of the emerging risk. There were multiple communications with school administrators to determine the best way to inform families of the risk. We identified a small number of public exposures, and we decided to close NJ to in-person learning, suspend extracurricular activity for those under age 18. By evening on May 2nd, we identified about 6 students with confirmed infection and about 10 students with probable infections. We learned some of the children with probable infections were attending other schools in Yellowknife, that there were many school bus contacts and many contacts through recreational activities. We determined that the students with probable or confirmed COVID were dispersed through many classrooms at NJ, and there was a much greater risk of transmission through the school than we initially suspected. We determined that all those attending NJ were contacts to COVID-19, and that staff or students from NJ should isolate and their household members should isolate too. We decided to close schools in Yellowknife, in Dilo, and Detta, and to make indoor masking mandatory in Yellowknife. We recommended deferring non-essential travel in and out of Yellowknife region. We recommend that people work from home in Yellowknife if possible. By May 3rd, we identified 1,000 contacts, including contacts who lived or worked in Betchico. We recommended closure of schools in Betchico and expanded mandatory masking indoors to Ndilo, Detta, and Betchico. On May 5th, there was a new order clarifying school closures and requiring those who are contacts and their household members to isolate on their own property. Next slide, please. So this is an epidemic curve indicating the dates when adults and children develop symptoms of COVID, including the dates of some key actions. And really important here is that about 9 students had symptoms of COVID in the week April 26th to April 30th. That means that at the time of the first diagnosis on May 1st, there was a very high amount of transmission among students. In some classes, almost 3/4 of students ended up developing COVID, even after suspending in-person learning after April 30th. There was a high risk of subsequent transmission in households. This epidemic curve doesn't show the difference between people who acquired their infection at school versus households, but you'll see that as, if we did display that, you'll notice that as the adults started developing COVID, we started detecting multiple transmissions in households. In this outbreak so far, about 71 people developed COVID, including 12 adults. There was no transmission to adults identified in the school. There were 43 households with at least one person with COVID. Next slide, please. And so this slide shows the differences between children and adults with COVID and shows the testing numbers as well. 59 of the 71 infections were in those aged 0 to 16, and that was 83% of the infections. The remainder were in adults with a range of ages from 26 to 68. This age range demonstrates that there were some people at high risk of severe COVID outcomes based on what we know about COVID risk and age. About 2,200 people were tested as part of the outbreak response, involving 3,641 tests, with a 2% test positivity rate. Important is that 6% of 60 fully vaccinated adults developed COVID from household exposures, and about 22 in 84 unvaccinated or partially vaccinated household contacts developed COVID. So in this Brief analysis, 2 doses of vaccine prevented almost 2/3 of infections compared to partially or unvaccinated household members. Next slide, please. As of May 31st, the majority of infections were acquired at school or in the household or in a similar setting such as a day home. There was no transmission at recreational activities like soccer or dance class. Because of the high number of contacts, the responding teams did lose capacity to actively check in on all contacts. This is a lessons learned, and we hope to address this gap by utilizing Statistics Canada resources for future large outbreaks. Return to school on May 17th was important. Children need to be at school. Our office worked with ECE and NTHSSA to develop enhanced screening, protections, and testing for school-aged children with symptoms. Next slide, please. The public health order of May 5th required contacts and their household members to isolate. This was an attempt to prevent community transmission in a rapidly evolving situation where we had almost 30 new diagnoses in the previous few days. On May 19th, our office began issuing letters to all families still isolating that as long as they didn't have COVID, they could leave their property for up to 2 hours each day, as long as they didn't enter indoor public places or be within 2 meters of people. This was to promote well-being for families who were isolating for long times. Next slide, please. Communicating public health messaging is a critical tool during the COVID pandemic. With every communication, collectively, we must decide who should the message be coming from? The Chief Public Health Officer, Public Health Nurse, Regional Health Authorities Management, Health Services. Who's the intended audience? Is it classroom contacts at NJ Macpherson, all students at NJ Macpherson, the entire Northwest Territories? What mode is best? Should we issue a public health advisory? Should we issue a letter to families? Should this be social media? Importantly, we must decide about the objectives and what is the main message. Public communications should protect the public from harm. The outbreak was evolving rapidly, and communications that we developed were sometimes no longer relevant a few hours later. On some occasions, there was true collaboration. Our office would compose the body of a letter, send it to the NTHSSA for their review and signature, who sent it to school administrators, who sent it to school families. We used many forms of communications, including public exposure notifications to empower the public to take control of their own risk. Daily notifications became a way for us to communicate any new updates or new directions. We developed a frequently asked questions document, information sheets to try to communicate about confusing topics, social media to get quick points out, such as, yes, it's okay for residents of Yellowknife, Ndilo, Deta, and Betchiko to go camping on a May long weekend. Importantly, some households had very unique situations, and the most important communications were those between the public health nurse and the home. Next slide, please. And as Premier Cochrane and Minister Green said, this outbreak required an incredible effort by public health nurses, laboratories to perform and result testing, the Territorial Medical Director and Regional Health Authorities Management, the Communicable Disease Control Team and Epidemiology and Surveillance Unit in the Office of the Chief Public Health Officer. NWT received a field epidemiologist from the Canadian Field Epidemiology Program, whose work was invaluable, communications team and others in the COVID Secretariat, Department of Health and Social Services, Department of Education, Culture and Employment, and most importantly, the incredible sacrifice and efforts by students and their families, isolating in Yellowknife and surrounding communities that protected NWT. There are opportunities to improve the response. We needed to clarify communications to the public on isolation and testing recommendations. We needed to coordinate outbreak response activities. We needed to improve the experience of families isolating. We needed to improve the specific communications to them. We needed to provide them with tangible support as they were isolating. We needed to improve rapid response efforts to coordinate the most important actions, such as prioritizing the most important tests. We needed a more effective and efficient approach to interviewing and providing guidance to people during contact tracing efforts. Some important good outcomes include the massive contact tracing and testing campaign. Outside of school closures and suspending recreational activities for those under 18, businesses remained open and there were no restrictions on other activities. The vaccine rollout team, including the regional health authorities, were planning Pfizer vaccine rollout for 12 to 17-year-olds in NWT, and this outbreak demonstrated the need to protect this age group. Health Canada licensed Pfizer vaccine for those 12 and older in early May, and this all resulted in an effective vaccine rollout for this group. Schools reopened on May 17th. Children missed 2 weeks of school. Strong community support for those who are isolating. There's strong collaboration and sharing of resources between ECE, schools, NTHSA, and our office. Our office reached out to some families to review their specific concerns, try to clarify problems, and have discussions about the risk of the situation and why we were recommending the things we were. This is also a lessons learned. Maybe we should have done a little bit more reach out earlier from our office. Overall, we'd like to thank everyone once again. Everyone in NWT has experienced hardships during this pandemic. We've each given up something so that others can be protected. The NJ outbreak impacted many students and families. Our office applied a principled management approach and imposed restrictions that we felt were necessary. 71 people ended up with COVID still. Students and families followed guidance. All this resulted in no serious COVID-19 outcomes to date from the outbreak. We hope that the path that everyone traveled in this last month was the one that produced the least amount of hardship for the territory and allows us to emerge in the best possible way. Thank you.
Thank you, Dr. Delabizzi. So I think we finished all of the presentations. I think we're ready to move into questions. So I'll just remind members here that if we can keep our questions focused and short, then we'll try to get through at least a couple of rounds for everybody. And I would ask the same of our guests this evening, if you could keep your responses focused as well, that'll help us move things along. So I've got a list here, and I'm just going to go in alphabetical order. And I'm going to go to Emily Cleveland first for questions.
Thank you very much, Mr. Chair. I was not expecting alphabetical order, so this is a treat. Thank you very much for that, and thank you very much to everybody for coming this evening and making time for us, because we do have a lot of questions. I'd say a good place to start would be when all of this first happened last year and we all went into restrictions, we all went into lockdown, what we were told right off the bat is we have to flatten the curve and we have to do our part in order to not overwhelm the healthcare system. And so it appears that a lot of the restrictions that we're under now are working on a different matrix or a different kind of policy foundation. And so I'm wondering if the CPHO can speak to what kind of a risk matrix they're using to determine extending the public health emergency and what they're basing their policy and restrictions on. Thank you.
Thanks, Emily Cleveland. Dr. Kandola, please go ahead.
So in anticipation of this question, I brought part of the legislation that talks about state of public health emergency and what the chief public health officer can do for the purpose of protecting the public health and preventing, combating, or alleviating the effects of the public health emergency. So having a state of public health emergency basically builds our capacity to respond. So it allows me to appoint Deputy Chief Public Health Officers and Public Health Officers during this period, and it also allows us to authorize qualified people to render aid. It allows recommendations to the Minister to accelerate territorial temporary license for medical practitioners, to make the orders and provide directions around restriction of or prohibiting travel. We can coordinate and provide for delivery of medical services in any part of the Northwest Territories, and then we can work with the other governments and provinces to provide healthcare related services. We can procure and provide the distribution of medical supplies and equipment. We can acquire any real personal property, whether private or public, and then we can establish a voluntary immunization program for all a part of the Northwest Territories. And we can authorize any person to implement direction of the Chief Public Health Officer to enter any premises, including polling places, without a warrant. So this is what the powers that I have. The intent has always been around the not overwhelming the healthcare system. Okay. We have never wanted to get to a COVID-0 state. It has been the fact that we now have variants of concern that can explode rapidly in a largely unvaccinated population. So the NJ outbreak has demonstrated that in the course of a few weeks, we can get 71 cases of COVID. And it could have easily led to community transmission if it was not for the concerted efforts of the families, the parents, the school system, and the healthcare providers. What we know, and this is what you're going to see next week when we start to show the vaccine uptake, that there are many communities with that same level of vulnerability, whether a large populations of unvaccinated. The difference is it's not a large population of unvaccinated children under 12. We're talking about a large numbers of unvaccinated at-risk older people. In those areas, if there was to be a similar introduction of a variant of concern of what we've seen in NJ and the similar level of spread, that could quickly overwhelm hospitalizations, ICU admissions, and even result in death. At this moment, the state of public health emergency is used to keep NWT residents safe. And at our level of vaccine coverage, and given the new variants, we still need to keep it in effect, and we still need to protect the public. Thank you.
Okay, thanks, Dr. Kandola. I'm not sure the question was communicated. Well, I'm going to give Emily Cleveland another chance to ask a question. Please go ahead.
Thank you, Mr. Chair. My question was in regards to if our goal is to flatten the curve, we've done that. And if our goal is to not have, overwhelm our healthcare system, the people of the Northwest Territories have done that. And so I'm just wondering, what are we then basing the restrictions on in order to keep it like that when we're still heavily restricted within the territory, not just along our borders? So that was kind of where my question was, but I don't want to lose my second question either. And so I'll go right into my second question, I guess, Mr. Chair.
Sure, go ahead. And if we can keep our questions and responses a little more focused, we can get more people through. Thanks.
Thank you very much, Mr. Chair. So I guess my second question then is, I would be remiss to not bring up the NJ Macpherson outbreak, considering how much time my office spent working with constituents on this. I'd say the best litmus test of good communication is what's happening within your community, and the community was definitely in chaos during that time. There was a lot of confusion. 811 was giving different answers. 811 versus public health was giving different answers. And it was very difficult for people to get consistent information. It was very difficult for people to stay up to date on what was going on. And it was also frustrating for people to hear that the Office of the CPHO had been preparing for this for a year when what was felt on the ground was definitely not that. And I think maybe what happened was the office was definitely preparing for the outbreak, but maybe not from the perspective of the people involved. And so I think that it's really important because the confusion that was felt on the ground really jeopardized the containment efforts of the outbreak. And so what I'm wondering is what specific changes have been made in how information from the Office of the Chief Public Health Officer is distributed to protect NWT and public health, and more importantly, from the OCPHO to the public going forward in potential future outbreaks. Thank you.
Thanks, Emily Cleveland. I'm going to first turn to Dr. Delapizzi for that one.
Thank you, Mr. Chair. So the situation really was evolving rapidly, and there would be situations, for instance, when we identified that we really felt it was important to test children before they returned to NJ school. And we realized that initially we thought it was just a couple of people that might not be able, some children were not able to be tested before they went back to school. And we quickly learned, for instance, that it was 30 or 40. So we did have to adjust our communications on a regular basis, and it did cause some confusion, there's no doubt. We were meeting regularly with the Yellowknife Public Health team. I think we can improve our communications in that manner as well. But overall, we know that the Yellowknife Public Health nurses were really engaging with families, trying to answer questions. We tried to answer questions if we knew there were still troubles or situations, and we tried to really find consensus for each family and find safe ways forward for each family.
Okay, thanks, Dr. Delapizzi. I'm going to move on to, I believe, Emily Johnson, you're up next.
Thank you, Madam Chair, or Mr. Chair. I look forward to seeing the new Emerging Wisely plan next week, and I think we're all excited to see that. I guess I'm just a little confused how we got here. As far as I can tell, in the current Emerging Wisely plan, we should be in phase 4, And can I just get in a bit of an explanation of why we have not moved into phase 3 or 4? And I'm not following our original plan. It doesn't give me much faith in getting a new plan when we haven't followed the original one. Thank you, Mr. Chair.
Thanks, Emily Johnson. I'll turn to Dr. Kandola.
So we will speak specifically about the Emergency Wisely plan on Monday, when we can talk about the direction that we've taken, and we've taken the same direction as other provinces and territorial jurisdictions, and we'll be looking at specifically the vaccine uptake. But just quickly to respond back to Emily Cleveland, having an outbreak of 71 cases in 2 weeks is not flattening the curve. And if the system was overwhelmed, one of the things people look at is the health system in terms of the hospital and ICU admissions, but the public health system was overwhelmed in terms of we had people working long hours into the night trying to bring this outbreak under containment, and it was thanks to the parents and thanks to their ability to comply with public health advice that it was a success. Despite the communication issues, the success has been that we did not get community transmission. And when this 43 households experiencing outbreaks in Yellowknife, it should have led to community transmission. So in my estimate, the success lies in the families who sacrificed and were able to contain this outbreak.
Okay, thanks, Dr. Kandola. Emily Johnson, you have a second question?
Yeah, thank you, Mr. Chair. I guess I'll await the plan, and I'm sure I'll have lots of questions when we finally get a look at that. I guess perhaps not into orders right now. There's presently a recommendation against travel out of the Northwest Territories. I know this has caused a lot of people a number of problems. Can I just get an update on whether the CPHO intends to alter that recommendation, and whether she has a different recommendation for travel if you are fully vaccinated and willing to self-isolate for the current 8 days? Thank you, Mr. Chair.
Thanks, Emily Johnson. Dr. Kandola?
Absolutely. That information is, again, in the new Emerging Wisely plan. And so we provide the indicators and the different stages and what's required to move forward, not only in terms of indoor-outdoor gatherings, but on duration of isolation, on leisure travel, and hopefully eventually one point in lifting the travel restrictions, self-isolation order. That is the Emerging Wisely plan, and that will be provided to the MLAs on Monday.
Okay, thanks, Dr. Kandola. I'm going to turn to Emily Martsalis.
Thank you, Mr. Chair. First of all, I want to thank the CPHO and our Minister of Health and Social Services for keeping us safe during the pandemic. But now that we're safe and we are almost zero cases in the Northwest Territories, I'd like to know how the CPHO and the government is working with the community leadership and the MLAs to in the decision-making process to reopen the Northwest Territories, not only in the communities and into the larger centers within the territories, but I'd like to know kind of a time frame when we're going to be able to go over the border south. That's my question. Thank you, Mr. Chair.
Thanks, Emily Martsalis. Dr. Kandola?
So the good news is that we are going to be able to move forward, but it will be based on the level of vaccination, first dose, second dose within NWT, and also the national level coverage and the number of cases, daily case counts. Each of those indicators will move us further along into relaxing outdoors, indoors, decreasing isolation periods, and eventually to uplift the state of public health emergency. So the different stages are outlined in the Emergency Wisely plan. So next week, not only will I be talking to the MLAs at this table, on Monday, I will also be talking to the Indigenous governments. I will be talking to the NWT Association of Communities. And people will be pleased with, I hope, with where we're going. Most of the provinces, when you look across Canada, they're emerging from a point of containment or heavy restrictions. And so they're moving in various phases. For our Emerging Wisely plan, we've done our best to keep community transmission to nil. We have yet to declare the NJ outbreak over, which we'll do the end of next week because we still have people who've been exposed that are isolating. But we're further ahead than most other jurisdictions, and that will be reflected in our Emerging Wisely plan. And so you just have to wait till Monday and you'll be able to see yourself, but this will answer some of the questions that are being asked right now.
Okay, thanks, Dr. Kandola. Emily Marcellus, second question, no? Okay, thank you. I'll move on to Emily Knockleby.
Thank you, Mr. Chair. Mr. Chair, somewhere in all of that, I heard someone say that they would be removing the phased approach for the Emerging Wisely plan. To me, when I hear that we're removing a phased approach and one that we never really followed to begin with, I'm concerned that no phases means no targets, no measurements, etc. So no thresholds. We didn't see those upheld or even followed in the first plan. So I'm concerned that they've just now been completely removed in the second plan. So will the updated plan have thresholds around loosening these restrictions? For example, many of the other provinces all have sort of criteria and dates associated with when they're looking to loosen restrictions, and I'm just wondering if the updated plan will include that type of threshold measurement, etc. Thank you.
Thanks, Emily Knockleby. Dr. Kandola.
Absolutely. We will be looking at indicators and we will be giving timelines. The good news is on our first threshold, we have this week alone, we finally met that indicator. So next week we can relax some restrictions because we have met that threshold. There are other ones we will have to beat, and you will know when we release the Emerging Wisely plan, and it will be a cooperation, but I am confident that we will be able to meet the various thresholds and in the time period. So next week is our first restriction lifting for specifically outdoors, and then we will progressively go depending on vaccine indicators throughout the summer into early fall. And it will be a clear direction with clear indicators. What is unique with this Emerging Wisely plan is that we can now use vaccine coverage. We didn't have that in early 2020, and so we used the phased approach, anticipating that the vaccines will be available in phase 4. But thankfully, we were able to get vaccines, we were able to roll it out, and so some of the relaxations can happen and ensure that the NWT residents can maintain safety. At the same time, we meet these thresholds in a practical way, and they're achievable throughout the summer up until early fall. And that information will be provided on Monday.
Okay, thanks, Dr. Kandola. Emily Knockleby.
Thank you, Mr. Chair. I'm just going to borrow a phrase that you used. That was a very long yes. So moving on, I loved that I heard that there was a lessons learned exercise conducted around the NJ Macpherson outbreak. I would just like to ask that while some of those were shared with us, I'm curious to know if there was an actual sort of format or formalized approach or lesson or exercise that took place, which method was then used, and would that information then be able to be shared with us? I believe that there are methodologies that could be used and applied rather than just anecdotal lessons learned from your staff. Thank you, Mr. Chair.
Thanks, Emily Knockleby. I'm not sure who to direct that one to. Maybe I'll start with Dr. Delapizzi. Thanks.
Thanks, Thanks, Mr. Chair. So we really like to do formal and a follow-up formal methodology to do a review of an outbreak. We started working on that for previous outbreaks, for measles outbreak, and that is certainly being planned. The outbreak isn't declared over yet, and so we are certainly planning that, yeah.
Thanks, Dr. Delapese. Now I'm going to move on to MLA Samar.
Thank you, Mr. Chair. First of all, I want to say from the residents of the Beaufort Delta, thank you for the announcement yesterday. Very, very, very happy people. I mean, it's a small step in moving forward. And I know that some of the other MLAs ridings got some flack afterwards, and I get that, but where we live, people in the south part of the territory don't understand, and there are 0 cases in both territories, and I, again, starting off, I just want to say thank you for that. It's the next question that I do have, and it's kind of to go back to the beginning of when we started the questions with MLA Cleveland. I think the main thing is people in the Northwest Territories want to plan for the future. They see the light at the end of the tunnel in BC. They see the light at the end of the tunnel in Alberta. We don't. And yes, you said there's a plan coming next week, and I'm hoping there's targets and there's measurables and we stick to them. But in the presentation, the CPHO continues to bring up variants. With this virus, there may be variants forever. We have flu viruses every year that change. Some are more contagious than others. We've had this in the past, and I don't think that we should be using that as a tool. I think we should continue to move forward. And so what my real question in just a plain answer is what is the risk measurement? Is it, and I know she said it's not 0, so what is it? So when can people like MLA Marcello says, when can we expect to actually, and what numbers do we need to be at to leave the Northwest Territories? Family reunification, we're going to lose staff. And I brought this up again last year, and we've struggled, and we're going, this year after 14 months, summer's coming, and if people know that they're going to still be having to isolate when they return after summer, we're going to lose staff, we're going to lose teachers, and it's mostly going to be outside of Yellowknife in the small communities. And I'm really worried, so we need to have those answers before we hit summer, and I'm hoping that the Chief Public Health Officer can answer that.
Thanks, Emily Semler. Dr. Kandola.
So there will be a meeting, I believe it's June 7th with the AOC to detail emerging wisely plan that will provide all those answers, and that's definitely before June 21st, which is the first day of summer, so you'll get your answers on Monday.
Okay, thanks, Dr. Kandola. Emily Semler.
So in that document, do you think that we'll be able to meet the criteria in that document? Because I'm sure it's done before September. Thank you, Mr. Chair.
Thanks, Emily Semler. Dr. Kandola, if you could maybe speak to what sort of path there is forward or where we might expect to be in September, that would be great. Thank you.
So the one criteria has been met for relaxed outdoor gatherings. Relaxed indoor gatherings really depends on the vaccine uptake, and we have other criteria related to national uptake and daily case count, which based on the current coverage, I anticipate all this will be done before September.
Okay, thanks, Dr. Kandola. The next person I've got on the list here is Emily Simpson. Please go ahead.
Thank you, Mr. Chair. And I do appreciate and thank you for the presentation and being here in front of us this evening. I guess the questions that this government has to ask are based on the fact that a majority of people in Canada and the NWT have received at least one vaccination, and that restrictions in many parts of southern Canada, we see being relaxed, and people are getting anxious that we're moving too slow. And the reality is that residents are not able to hang on much longer to us saying soon or be patient. We've been saying it, for the last year and a bit. And when I look at the Public Health Act, it identifies significant risk as a driver for declaring a public health emergency, and followed by reasonable measures to mitigate that emergency. So my first question would be, does COVID-19 and known variants currently really pose a significant risk, and what criteria is used to make that determination? And does it continue to warrant a public health emergency here in the NWT? Thank you.
Thanks, Emily Simpson. It sounds like a question for Dr. Kandola.
So I believe we've been a victim of our own success. We have seen how quickly an outbreak can explode in an unvaccinated population, but this unvaccinated population was mainly children under 12. What we haven't seen is what's been experienced by Manitoba, Ontario, Alberta, pretty much most of the southern provinces, is an explosion of cases in an unvaccinated Indigenous community. And at that point, I would hate that to happen, because then you will see that there is a risk. There's a risk for increased hospitalization, ICU admissions, and death. We have worked hard to protect NWT with all the safety measures that we have placed. When we do relax, we will be at a much further stage of relaxation than the rest of the provinces that are relaxing in stages from a sense of containment. But we need to be careful and learn from the lessons that we have seen down the south, that we cannot have introduction of a COVID variant, which is highly transmissible, in a largely unimmunized smaller community, because vaccine coverage is not the same across NWT. So we need to be measured and careful, because I do not want NWT to learn the lessons in a hard way, but we will relax according to our vaccine coverage, at the same time maintaining safety for the smaller communities that are not at the same levels of vaccine coverage as we are and are vulnerable.
Okay, thanks, Dr. Kandola. Emily Simpson.
Thank you, Mr. Chair, and thank you for that answer. Second question is, based on current risk, do the orders continue to provide reasonable measures, and can those measures allow for fully vaccinated persons to travel, and upon return to self-monitor instead of self-isolate? I think people, they had a year to see what's happened. They know, I think, the rules. I think people are smart. Most people are smart enough to realize that they still have to, to mask up. I think they need to know they got to, wash and that type of thing, and also to self-distance. So I think people are a lot smarter than we give them credit for, and that they want to see a change. And I think, at least for people in Hay River, once they heard that Inuvik, or the people in the north, were able to go to the Yukon, I got a lot of calls. And, there's a big push to try and open the borders. And, the people who have received vaccinations is to loosen up the restrictions for them. Thank you, Mr. Chair.
Thanks, Emily Simpson. Dr. Kandola.
Absolutely. Based on national vaccine rollout and anticipated decrease in daily case count, there would be varying isolation requirements. So first, for fully immunized individuals, that they would move to a self-monitoring phase and not have to isolate, and then varying the pace, depending on the national, again, vaccine uptake and the number of cases, varying isolation requirements depending on if you're partially or vaccinated or unvaccinated. So that is part of the plan.
Okay, thanks, Dr. Kandola. I'm going to squeeze one quick question in if I can here myself. We've got quite a large range of vaccination rates even within the Northwest Territories. And, you showed us a map showing some of that regional variation even here this evening. Will the Emerging Wisely plan, how will it take account of that regional variation? Are there going to be possibly different measures or restrictions depending on the region, or is it just going to be based on some sort of NWT average? If you could, I think that's probably for Dr. Kandola. Thank you.
That's an excellent question. So we would have to go with an overall vaccine uptake. We would have to look at the territorial average to relax the restrictions. At the same time, we would need to show different communities that they have levels of vulnerability, that they may be at a lower level of vaccine coverage than the territorial vaccine uptake. So that puts them at risk. Whereas other communities are high, they have high rates of full dose vaccine uptake and 1 dose vaccine uptake. What we need to provide in the plan is that different people know their vulnerabilities, so they need to be able to assess their risk and make judgments accordingly, but the relaxing measures would be applied across the board. And that was the point that we're talking about, is self-assessment. So if you're not vaccinated, you're in a vulnerable community, you may make different choices than someone who's fully vaccinated living in a regional center where everyone has reached the targets.
Okay, thanks. I'm sure we're all anxiously awaiting the plan release. But I'll turn it over now to Emily Cleveland for a second go around.
Thank you very much. Mr. Chair, before I get started, do we have one question or two?
Two. Go ahead.
So my first question is for the Minister of Health and Social Services, Mr. Chair. So today in the House, when questioned by the MLA for Hay River South about approving the public health state of emergency, the minister responded, "At some point, I could disagree." Section 32 of the Public Health Act reads, "The minister, on the recommendation of the Chief Public Health Officer, may by order declare a state of emergency." So what I'm wondering, Mr. Chair, is what is the minister's threshold between continuing to declare a state of public health emergency and expecting Northerners to begin to live with a COVID world? Thank you.
Thanks, Emily Cleveland. I'll turn to Minister Green.
Yeah, thank you for the question. I don't have an independent threshold that I'm referring to in terms of making that decision. So I'm afraid I'm unable to answer that question at this point.
Okay, thanks, Minister Green. Emily Cleveland.
Thank you very much, Mr. Chair. Mr. Chair, I'm going to go over to the school screening tool that's currently being used in schools since the COVID outbreak. I have a concern, just as, I guess, as a parent and a community member, that we're asking a lot of kids and parents, and I know that there's a lot of anxieties that kind of built up with kids during the NJ outbreak, and that those anxieties are still holding pretty strong today, just a few weeks out. And my concern is that we're going to end up with kids who are either too scared to go back to school, or kids that are masking symptoms because their parents don't have the sick time to stay home with them if they have a sniffle, or kids who don't want a COVID test if they have a sniffle. So I guess the first part of my question is, will we be going back to pre-NJ outbreak screening tool? And my second part of that question is, does Health and Social Services anticipate getting this spit test for kids that's a little bit less invasive? Thank you.
Thanks, Emily Cleveland. I'm not sure who to turn to on that one. Okay, I see Dr. Kandola gesturing towards Dr. Delapisi. Why don't you start us off? Thanks.
Thanks, Mr. Chair. It's a really important question, and we know that Public Health Agency of Canada guidance, everyone feels that we have to figure out a way that people with symptoms of COVID don't go to school or don't go to work, and it really is difficult. So with children, the symptoms of COVID are similar to those in adults, but may also be very vague. A lot of children actually don't have, a significant proportion of children don't have symptoms of COVID. So I think that immediately after this outbreak that we thought it was important, especially looking at that epidemiologic curve that we showed that, there were students who had symptoms when we went back and talked to them who were there in that first week from April 26th to 30th. So our intention really was just to have a little bit heightened surveillance after this outbreak, and then we'll certainly reassess the risk in the new school year and try to manage the risk as appropriate with consideration of, how hard it can be for parents, educators, and kids. The second part of the question in terms of the swish and spit, we work so closely with Alberta. Alberta Precision Labs did produce a scientific brief on the saliva test in November of 2020, where they weren't sure that it was valid from their perspective. Many jurisdictions in Canada have adopted and implemented the saliva test, but Alberta hasn't formally. There are no standard procedures. It's not available clearly. So we're working closely with Alberta and also looking at doing scans of other jurisdictions. I'm not sure if Dr. Kandola or Dr. Peck have anything further to add. It's kind of a collaborative effort.
Dr. Delapese. Dr. Kandola, go ahead.
Sorry. Health Canada hasn't approved a saliva-based measurement for COVID, and if they did, we would all be anxiously waiting for this because nobody likes the nasal swabs, especially the nasal pharyngeal swabs. Health Canada has approved an at-home self-testing kit for COVID, but that doesn't answer the question because you still have to do a nasal swab. So we have to wait to see what validated credit system there is and continue to innovate.
Okay, thanks, Dr. Kandola. I'm going to turn to Emily Johnson.
Thank you, Mr. Chair. I guess my understanding is that the main concern right now, and the reason for the restrictions, is that we have areas of low vaccination, and we've seen how quickly COVID can spread in those areas. And if it's not children and it's a different population, that there is still a significant risk. And I understand that. I guess I am concerned to see how the vaccination rates have plateaued and how we're really going to get over that hump. And I guess I'd like to speak recently to the Yukon exemption, where we seem to be letting people in regardless of vaccine status. And I guess personally, I don't want a Yukoner coming here and not self-isolating if they don't have a vaccine when everyone else has to. I don't really understand that reasoning, and it certainly doesn't seem to do anything to incentivize vaccination. So can I just get an explanation of why we would let unvaccinated people into the territory be exempt from self-isolation? Thank you, Mr. Chair.
Thanks, Emily Johnson. I think I'll turn to Dr. Kandola.
So the Yukon and Nunavut are unique in terms of their territories with low COVID cases and also have high vaccine coverage. And anyone who is applying from Nunavut or Yukon have to still submit a self-isolation plan. They don't get the exemption if they are a close contact of COVID, if they are symptomatic, if they've been part of an outbreak cluster, or if there's been restrictions on their community. This exemption of this bubble more reflects that the two territories are unique and different from Alberta, where this type of approach could not be applied, in that they were coming from a very low risk area. And I'm looking specifically at the Yukon exemptions. The Yukoners who had to isolate, they're coming from Old Crow, Mayo. They're not traveling out, they're visiting relatives, sharing child custody, and the hardship on the northern region of Yukon had resulted in providing this exemption based on public health risk assessment. So my public health risk assessment is low for Yukon, but this type of exemption is not something that could apply for Alberta, for instance.
Thanks for that explanation, Dr. Kandola. Emily Johnson?
Yeah, thank you. I get that. I get it from a perhaps a public health perspective, but it seems to me we missed an opportunity to encourage vaccination by, just saying you can be exempt from self-isolation regardless of status. And to me, we need to be doing everything possible to get that vaccination target up. I guess if the concern is around unvaccinated people, I think we've proven how effective the vaccines are. And I'd like to kind of understand, during the NJ outbreak, we required people to isolate, to not leave their property, and it was regardless of isolation status. So we had this situation where I believe I heard Dr. Delapizzi here say that there was a 3% chance of a household contact getting COVID if they were fully vaccinated, weren't able to put on a mask and go for a walk. And I just can't understand what health risks we're trying to mitigate there. So I guess my question is, if we have another outbreak situation, are we going to stick to that rule where people cannot leave their properties? Because I had some constituents stuck in apartments for weeks at a time there, and it just seemed inhumane to me to not let them go for a walk, especially when they're fully vaccinated. Thank you, Mr. Chair.
Thanks, Emily Johnson. Dr. Kandola.
So I can start. Actually, with this NJ outbreak, we actually had a 9% infection rate in the people fully vaccinated, 16% in partially vaccinated, and 25% in unvaccinated. When it was interesting, because this is the UK variant, highly transmissible, and when it came to household contact, there was a significant spread to households, and it also included fully vaccinated individuals being exposed and symptomatic with COVID. The difficulty with the isolation order is, we're talking about isolation order related to being in close contact with COVID or having a COVID case in your home. It's different from someone who's an out-of-territory traveler who has a low risk, but who's required to self-isolate. This is actually a true exposure. And it was a difficult decision to make, but we needed, if we didn't isolate, contain as quickly as possible, especially with a pediatric population that would go off property and hang out with other children and perpetuating exposure, we would have easily dealt with community transmission. There are other jurisdictions that in mid-April declared an outbreak, shut down the schools, shut down the restaurants, and it's now June 3rd and they still have active outbreaks. We tried to act quickly, close schools, and contain the outbreak of 43 households, but we were so close to the edge of the community transmission. And if we had community transmission in Yellowknife, we wouldn't have this emerging wisely plan that I'm ready to release next week, because we would have active cases. So when we have active cases, there's no way you would want to relax restrictions. So this was a really tough decision, was to come down quickly, put down restrictions quickly in 43 households to allow no community transmission, and to eventually handle and contain the outbreak, to allow schools to continue for the rest of the year, and also to allow further relaxation of restrictions that will come next week. So you'll see the full plan. But if we hadn't had the cooperation of the households and their sacrifice, we wouldn't be talking about emerging wisely right now. We would actually be dealing with community transmission, not only in Yellowknife, but in other communities that frequently traveled here back and forth. And so that hard lockdown restriction worked, and we realized it was a sacrifice, and we say thank you to the parents and the families for sacrificing for the good of not only Yellowknife and Dilo, but Betchiko and Deda as well. Thank you.
Thanks, Dr. Kandola. I understand that Emily Jacobson has a question on the phone. So Emily Jacobson, please go ahead.
Thank you, Mr. Chair. Thank you, everybody, for coming and answering some of our questions. But the question I have is for the small communities. We've been having a lot of deaths in our communities, and we've been really, and we've been in our own social bubble. There's been no outsiders coming into the community. And I'm just wondering, come Monday or whenever, are there going to be laxing the funeral capacity inside the building, I guess, for funerals in the territory? Thank you, Mr. Chair.
Thanks, Emily Jacobson. I'll go to Dr. Kandola.
So the Emerging Wisely plan, what you'll see vaccination coverage for NWT, both first dose and second dose, the national vaccination coverage, first and second dose, and then you'll see various actions related to those rates. The first indicator we've met is relaxing of outdoors. So what you'll see is measures around outdoor funerals. The measures around indoor funerals will be later when we can achieve the level of first and second doses that you'll see in the Emerging Wisely plan. In terms of visitors going right into small communities, that later on, that would all depend on their vaccination status and how long they would have to isolate.
Okay, thanks, Dr. Kandola. Emily Jacobson, you have another question?
Yes, sir. Thank you, Mr. Chair. Dr. Kandola, with the Emerging Wisely, if we, like, say, Sax Harbor, Paultuck, Ulakuktuk, Gortuk, 3 off-grid communities that have a funeral service, there's nobody coming in. Again, I just want to stress that, our funerals, we've been having way too many in my riding since the last sitting. I had 7 deaths, and it's been really hard. And one of the things that we've been really having a tough time in regards to, just your mental, from depression to everything. Are we doing anything to help, or able to help with anything like that? Thank you, Mr. Chair.
Thanks, Emily Jacobson. I'll try going to Dr. Kandola first.
So I can answer part of it, and then around mental health supports, I'll defer to Dr. Pegg. In the Emerging Wisely plan that will be presented on Monday, we will be easing restrictions in a safe and measured approach. Having an outbreak that involves elementary school kids is not the same as having an outbreak in a small community. And so we have to have measured approach on funerals and isolation and vaccination status. So that will be all outlined in the Emerging Wisely plan.
Okay, thanks, Dr. Kendall. I think you mentioned that Dr. Pegg might have something else to say. Dr. Pegg?
Yes, thank you, Mr. Chair. So for mental health supports, it's certainly been evident that the prolonged months of restrictions have been complicated for residents of the Northwest Territories and that people are tired. What we have been able to offer in a number of communities have been expanded access to supports through the health centers, but also through some various electronic measures. These are available to find on the NTHSSA website. We search for COVID mental health resources. We can also forward directly to the Emily Jacobson who's posed this question, specific mental health supports that would be available in his riding. I'm happy to do that if there are specific questions for him. There are child and youth care counselors that are present in the communities that have also been able to offer both in-person and virtual services for children and youth who are in school and who are out of school. They're able to link families with resources. There are community counseling programs that are available for residents of the territories in all of the communities. And I would also encourage residents, if they are feeling overwhelmed or if they are feeling that they need to talk to somebody, to please get in touch with the health center who can help them navigate through the system, because I do admit also it can be complicated to work through.
Thanks, Dr. Pegg. Next on my list is Emily Knockleby.
Thank you, Mr. Chair. Mr. Chair, I'm just going to come back a bit to what MLA Cleveland was asking about, because I'm not sure she quite got an answer to the question as to whether or not we would be going back to the different or the earlier screening tool for students in schools. Not having as many parents of NJ students in my riding that MLA Cleveland did, I didn't have the same amount of people reaching out to me. However, I did have some and some that, were in isolation for almost like 30 days. And one of the comments that was consistent from almost all parents was, A, they were not going to isolate their child away from them inside their home. That just wasn't going to happen. They would take the risk of COVID before they would do that to their child. There was a lot of comments made about children with special needs that really could not handle the nasal swabs. Lots of comments that people were going to hide their child's illness or, known allergies, that type of thing, and were worrying about having to isolate. And many of these parents that contacted me were private sector parents, not GNWT employees, people that couldn't afford to take the leave or have any opportunity to do so. So I guess I just really wanted to come back to if those spit tests, or sorry, that's not, what's the saliva test, is not being done currently. It is being done for over a year in other parts of Canada. So I feel like I'm not, waiting for it to be 100% certified. And I've done a lot of lab analysis or lab sampling and testing in my life too. So I do understand that you're talking about certification. However, in this instance, I think that we have to look at the damage or what we're doing to children in this and have that as an option available, even if it is not at the 100% fail-safe set. Because I'm not sure if you watch session, Dr. Kandola, but I talked about risk aversion the other day, and I feel like we're moving now into this situation where we want to be 100% safe. We're so risk adverse that we're actually now doing a lot more harm the other way, in my opinion. And I feel like we're just running in place. So I think that there really does need to be a hard look at these saliva tests, and maybe it doesn't have to be a blanket across the board thing, but I don't accept that if the rest of Canada is using it for over a year, that we can't do it just because. And if that's the case, maybe is it that Alberta can't actually test or do the work for us? Is it a time constraint issue? Maybe you could explain a little bit around that. Thank you.
Thanks, Emily Knockleby. I'm not quite sure who to toss this to, whether it goes to Dr. Pegg or Dr. Kandola. Why don't we start with Dr. Kandola?
So right now, we have about 3 weeks left of school. So the main concern is to maintain measures so that all the children can finish school and we don't have to close schools again. And we do have the school screening tool because unfortunately, by the time one parent had tested their child and tested positive for COVID, there was a number of symptomatic children with mild symptoms that could have been picked up with the school screener. Our main aim is to be able to prevent outbreaks and prevent outbreaks from spilling into the communities. One of the ways we have got around in terms of surveillance is we are looking at wastewater surveillance downstream from the schools, so that if we're testing the schools and the wastewater is negative, that's a really good validation that we're not picking up an outbreak situation. And then we would have to think of innovative ways to provide testing. The main concern is if you do a swish and swallow and it's negative, is it really a negative? And does that result? What does that result mean? And so we have to take that into account, and really would like a test that can be very sensitive and specific at the same time.
Okay, thanks, Dr. Kendall. Is there anyone else who wants to speak to it, or? Oh, yeah, I thought, okay, Dr. Pegg, please go ahead.
Sure, actually, just to add some of the practicalities for the saliva-based test, Our landscape analysis is actually looked at where this is currently in use in Canada, and BC is actually the only jurisdiction that is routinely using it for a number of cases, and even then it's not entirely consistent. And some of the issues with the reliability of the saliva-based test are the difficulties in actually administering it. So it seems like it's probably more comfortable for children to have that versus a nasopharyngeal swab, the big Q-tip up the nose. But it does require contact with infected cells. In the majority of cases, for up to 30 seconds, children need to gargle, and there needs to be that contact with the testing solution for enough time to actually pick up an accurate sample. And I don't know how many of you are parents, but trying to get your child to gargle something and not swallow it and keep it in their mouth and then spit it out into a small receptacle after 30 seconds seems like it would maybe be less painful than a nasopharyngeal swab, but also maybe not, and maybe a bit wet for everybody who's involved. So we are looking at the swish and spit test, the saliva-based test, but there are, it's not the panacea that we would like to see for something. We know that it's painful for children to have the NP swabs. Throat swabs can sometimes be a little bit more acceptable, but the saliva-based tests have their limitations as well. Thank you.
Thanks, Dr. Pegg. That's quite helpful. Emily Knockleby, a second one. Go ahead.
Thank you, Mr. Chair. Yeah, I'm not a parent, but I can definitely imagine trying to hold small children down to do things like that would be difficult. And I do appreciate you talking a little bit more, explaining a bit more of the limitations there. I'm going to just shift gears slightly. As we're all aware, there was a bit of a story the other day about a breach in data and security here in the Northwest Territories when it comes to student financial assistance. We're all well aware of times when records get faxed to the wrong place or things show up at the dump, et cetera, et cetera. The North is kind of notorious for this. So my question is around, could maybe someone in the department or COVID secretary speak a little bit around of the protection and privacy of people that are being tested, et cetera, versus sort of the weighing of the public health. I don't envy your position because we're a small territory and jurisdiction, so everybody does know everybody's business, which in some ways might help us keep COVID from spreading, but trying to maintain this wall of privacy, et cetera, while you're doing this is quite difficult. So maybe could someone explain a little bit if there's been any improvements in that area or issues that you've seen or things that you've had to change in order to protect people's privacy? Thank you.
Thanks, Emily Knockleby. I think I'm going to turn to the Minister of Health for that because it sounds like that would fall under the Health Information Act. So Minister Green, is that something you could help us with?
Thank you, Mr. Chair. I have no information in this area, and so I'm now going to pass the ball to the Deputy Minister. Thanks.
Okay, I believe that's Mr. Cooper. Are you able to help answer that for us?
Not really, Mr. Chair, just to say that we certainly, for all medical procedures and for all interventions that a citizen gets from our health and social services system, we follow privacy guidelines to ensure that that information is protected. And in circumstances when it is not, we follow the proper protocols to make sure that is disclosed. Thank you.
Thanks, Deputy Minister Cooper. I've got Emily Semler next on my list.
Thank you, Mr. Chair. One of the comments that the Chief Public Health Officer in her presentation did state was that there are low vaccine uptake, and we've continued to hear this in a couple of the regions. And I know that the department and, even our leadership has reached out to the leadership in those communities to try and, find out ways to increase the vaccination rates. But, as people know that I've worked in the public health field, and I know that there are people that just are not going to get vaccinated. And I think that's a question on some people that are having now in the territories is if there are regions or communities that are low rates and not going to get vaccinated, no matter what we do and how much education we provide, is that going to impede the rest of the territory moving forward in this plan? Or will there be, at some point, these, the communities will have to know that they will be at risk because we will be moving forward? Thank you, Mr. Chair.
Okay. Thanks, Emily Summer. I think there's kind of almost two parts there, but why don't we go to Dr. Kandola first, and then we'll go to Minister Green. I think Dr. Kandola can probably speak to how this might get reflected in the plan, and I think the minister could probably tell us about plans to try to increase vaccination rates. But Dr. Kandola, why don't you start us off, please?
I think Emily Summer raises an excellent point. We do have a community vaccination fund, and there's been many proposals submitted by the community leadership themselves to improve vaccine coverage in their own communities. Next week you will see the different levels of immunization, and you will see a difference in certain communities. Absolutely. For the relaxing outdoors, we do meet the vaccine target. When we go forward for relaxing indoors, if everyone who've already have got the first dose vaccine gets the second dose, we could meet that target. And some of the other targets in terms of relaxing relates to national vaccine rollout, which the government says they'll be reaching those targets hopefully end of June and end of August. So there are a lot of measures that can be put in place with people who've already chosen to get vaccinated, and also with the vaccine uptake is across the country. Ultimately, though, when we get to the point where we have to lift the travel restrictions, it would be important to have as high a coverage as possible, because lifting the travel restrictions will allow that increased risk to very vulnerable communities. And part of Emerging Wisely is to provide individuals how to do their own risk assessment, but because I get vaccinated doesn't make you safe if you choose not to get vaccinated. So that's a really important message to transmit.
Thanks, Dr. Kandola. Maybe I'd like to turn to Minister Green about what we're doing to try to increase vaccination rates through the department and THSS as well. Minister Green?
Question. What we have done most recently is created a fund for communities to initiate their own vaccine uptake initiatives. So they could spend the money on having staff go door to door. They could spend it on posters, videos, community feasts that are socially distanced. So the idea was to get the applications in as soon as possible and make decisions this month about where the money's going to go, so that the implementation of that fund happens quickly. What I've noticed that NTHSSA is doing now is another round of vaccinations. You might recall that one of the reasons that the department or the authority wanted Pfizer vaccine is because it comes in smaller vials. And so there are communities where they have waiting lists, and a smaller waiting list than 10 shots. And so there is an effort to schedule additional vaccine clinics. So this week, for example, there were a round of clinics in Nunavut Riding, as well as in Lutzelk'e today, or there will be in Lutzelk'e tomorrow. So one trend that I've heard MLAs speak about is that there were some people who were hesitant to get the vaccine, who wanted to see how that worked out for their neighbors, friends, and family. And they've gained some confidence as a result of the smooth rollout and limited side effects that they may now be ready for vaccination. So once again, we're trying to offer vaccine to everyone who's 12 and older in every community in the Northwest Territories. And if people want to be vaccinated and they haven't been vaccinated, I encourage them to call the health center and make sure their name is on the list there so that the health center has an accurate idea of how many people are ready to be vaccinated. That would help us a lot with our planning. So if you have any other ideas, then of course we're always ready to hear those. We understand that we have a key role to play in promoting vaccine uptake. Thank you.
Okay, thanks, Minister Green. Emily Simler?
Thank you, Mr. Chair. I'm going to switch over in another part of the NJ, and I'm not a Yellowknife member, but even Inuvik members were affected by, my constituents were affected by this outbreak in different ways. Some were here for medical, some, and then were just here to visit and then ended up in isolation for 2 weeks. So, there's, but one of the things that I remember hearing, and I know the Chief Public Health Officer has stated about wastewater testing just down from the schools. But I think during that time when there were first evidence of wastewater detected, it wasn't as high as they would have thought it was when with that many cases like the children. And from my understanding is now we're finding that children's waste is not as sensitive of spilling COVID virus, or their viral loads aren't as high, so that we're not picking it up. And I'm just wondering if there's, if that's the case, and what are we doing about it, and if we are getting wastewater detection in all the communities, so that way, if we're gonna start opening up and easing, and people they can start self-isolating and and home in smaller communities, will this be increased throughout the territory so that we can pick it up when we know that there's been nobody testing in that positive in that community? Thank you.
Yeah, thanks, Emily Summer. Certainly, as a Yellowknife resident, I was watching those graphs very carefully myself, and had expected they almost crashed there at one point, and we still had a lot of cases in Yellowknife. So, but Dr. Kandola, any thoughts on what Emily Summer has asked?
Everything she said is absolutely accurate. I think we found out that children don't seem to spill as much COVID virus through their fecal matter as adults do. We know wastewater has worked well in our December uptick. We saw it in Yellowknife, we saw it in Hay River, but it also worked initially with our initial Yellowknife cluster after March break. It was thanks to someone coming forward to get tested because of the wastewater signal that we were able to quickly detect 6 cases and isolate and contain them. What we saw with the NJ outbreak is when it's a pediatric population, it doesn't produce as high of a signal, but there was signals in the wastewater, and we did have a number of adults test positive. So this is something that we need to be aware of, but wastewater in itself has helped us at least in 3 or 4 different occasions. When it comes to small communities, the difficulty is it's around truck sewage versus a pipe system. In the 7 main centers, we have an auto-sampler where we have piped sewage. We can test it pretty quickly. But in the smaller communities like Fort Liard, we're setting up a truck system, and Baychoco, we have a different system. It makes it more complicated. And so for the smaller communities, when the people are traveling in, it's just a lot easier just to test the individuals when they're coming in than to test the whole community.
No, thanks, Dr. Kandola. I think that was, the wastewater sample is one of the most important things I think we did early on. So lots of credit to the folks that thought about that and carried out to protect us. I got Emily Simpson on my list next.
Thank you, Mr. Chair. One area that I guess concerns me is what mental health, I guess, plays with respect to the restrictions that have been in place. And I guess I would ask that in your decision to relax restrictions, how or will residents' mental health play a role in any decisions you make going forward? Because I'm finding that residents are getting anxious and they are at a breaking point, and they're looking for something to or something to look forward to, and we haven't given them anything yet. So, what role, I guess, has mental health played in any decisions that you've made or are going to make? Thank you, Mr. Chair.
Thanks, Emily Simpson. I'll turn to Dr. Kandola.
So after the COVID pandemic, the mental health crisis during and post-pandemic will be our next pandemic. It is not even, it's not just an issue for NWT, it's an issue for Canada and worldwide. This has been a huge strain, and we'll only feel and see the effects of what the restrictions have done in the coming months, even years. One of the struggles is weighing, as Dr. Pegg talked about, is all the mental health scores we can provide when we're trying to contain an outbreak. But when we were looking at the NJ outbreak, was trying to get schools to reopen as quickly as possible to keep schools locked down for 2 weeks. Mental health was at the forefront of how aggressively we worked, and having staff work all hours of the night to try to contain this outbreak as quickly as possible so that we don't further the mental health issues by allowing children to continue going to school for the rest of this school season. We knew that it was very easy for us to have community spread, to have had other major outbreaks in the school, and to have had the schools closed for the rest of the year. And so that's why we worked as hard as we did, and we are grateful to the parents who made the ultimate sacrifice for those 43 households that then allowed other kids to continue the school year. So, and we look forward to emerging wisely. The relaxation and the restrictions are balancing risk and benefits such as mental health, to have people have something to look forward to, and you will see that in the Emerging Wisely plan that will be revealed on Monday.
Okay, thanks, Dr. Kandola. Emily Simpson.
Thank you, Mr. Chair, and thank you for that answer. I guess one area another area, I guess, that really concerns me is that of seniors, because one of the most impacted segments of, I guess, of the society are those seniors that are in extended care, and they've been locked up for over a year, and I mean locked up for over a year, and they haven't really had access to the outside. They haven't been allowed visitors, and now it's limited, I guess, with the amount of visitors that can attend the facilities. And I was lucky I got in to the facility, and I was able to meet with one of the residents, and they're basically, what I'm finding is they're just kind of sticking to their room, and they're not even leaving their room anymore. And I know mentally it's taken its toll on them, and they're looking for something as well. They're looking for people, new faces, people to sit with them, talk with them, and that's something I try to do when I'm in town, and I haven't been able to do that for over a year. And the day that I did go in there, I felt really bad when I left, because I could see the look in some of the people's eyes that I usually talk with, and I guess they realized I was getting shuffled out of the building, and I couldn't stop and really talk to anybody. So that really concerns me, and I'm hoping that in this new document that you're actually going to have something in there that relaxes the restrictions on the extended care facilities and allow for more visitors, because it's something that's really needed, and being locked up like that, I know they're forgotten, and we just can't do that. So I'm hoping, that you can give us something good. So maybe you want to comment on that. Thank you.
Thanks, Emily Simpson, Dr. Kandola.
So in the Emerging Wisely document, we have relaxing restrictions, first with outdoors and then the indoors. So the overall relaxing restrictions should mirror the documents that policies will be developed by the NTHSA, who are looking after the extended care facilities and long-term care facilities. They will be mimicking the overall direction that I provide as the CPHO. So we know the weather is getting warmer, so if the overall direction is a relaxation around outdoor gatherings, we can connect with the NTHSA, those responsible for the long-term care facilities and extended care facilities, to mirror that type of relaxation for their residents. And as we move to relaxation of indoor gatherings, that same kind of policy shift occurs for those institutions as well.
Okay, thanks, Dr. Kandola. I think we've got Minister Green. You wanted to add some further information about vaccination promotion. Please go ahead.
That the $100,000 vaccine uptake fund has been fully subscribed, and that the proposals are very interesting and varied, and they do come from regions in which the vaccination rates are low. And so I'm looking forward to hearing that the money has gone out the door and people are implementing their ideas to increase vaccine uptake. Thank you.
Okay, thanks, Minister Green. It's probably about 30 degrees in the room here. A number of us are getting ready to pass out, so Emily Johnson, though, has one more burning question, so I'm going to turn to Emily Johnson.
Sorry, Mr. Chair, I could probably ask questions all night. I would just like a little bit more explanation on whether we plan to or why we're not currently testing everyone who comes into the territory. I understand if you're vaccinated, you can get a test on day 8 to get out, but I know for the ice road, for example, they were testing people on day 1 and then day 8, and they found it very effective surveillance, and I believe we now have the rapid testing capacity. So this was a conversation much earlier about using rapid testing to reduce the border, but at this point, are we considering just testing everyone? Because to me, that seems to be the threat, is travelers, and that would allow us to relax restrictions. Thank you, Mr. Chair.
Thanks, Emily Johnson. I'll turn to Dr. Kandola first.
So I wish we had just made this Emerging Wisely plan AOC, because all those questions that burning questions people asking are all in there, and that was exactly one of the approaches that we were looking at, because as we relax indoors and outdoors and NWT become new normal, and because we are so grateful to NJ families, we don't have community transmission, then where is our risk going to be? It's going to be basically importation. So when you look at importation, what's the better way to be able to have a grasp of what's happening? Well, there's wastewater surveillance, but it's also testing. And where are you going to get the biggest bang for your buck? Well, it's going to be around people who are partially or unvaccinated and people who are fully vaccinated in special conditions. So that's exactly in the Emerging Wisely plan. This is something that we were being considering as part of the plan.
Okay, thanks, Dr. Kandola. I don't see any other questions in the room here, thank goodness. But look, we really like to thank everybody who got together to answer questions for us this evening. It's been a very long day for us, but also a very long day, I'm sure, for everybody who's gathered to help us understand our response. And I just want to take this opportunity to thank everyone, Dr. Kandola, Dr. Delpizzi, and Dr. Pegg for all the work that you've done to keep the Northwest Territory safe. So I think we're going to end maybe I'll just turn to the Premier if there's any closing comments, and Dr. Kandola, if there's any closing comments that you'd like to make. Why don't we start with you, Dr. Kandola, and then we'll turn to the Premier.
So it's been 15 months. People are tired, and I just want to thank MLAs and NWT residents for sticking this through. We have, to date, we have 128 confirmed cases in NWT residents, and we've only had 4 hospitalizations, but we have had no deaths. And we have tried to keep NWT safe. And as we move forward to start opening up NWT, opening up, reopening our society, we still want to keep NWT safe in a measured manner, at the same time opening up as much as possible. So I thank you for your patience, and I really do look forward to sharing the Emerging Wisely plan next week.
Thanks. Yeah, I'm sure everyone's eagerly awaiting that. So, Premier Cochrane, any closing comments?
Thank you, Mr. Chair. I again just want to say thank you to everyone, to the whole health team, to all the businesses, and especially, Mr. Chair, to the residents of the Northwest Territories, and with this outbreak, the residents of Yellowknife. We work hard day and night, but we can't do this without you. So I know people are tired. We're all tired. However, it's been incredible, and by all of us working together as a team has brought us where we are today. So again, the key for me is vaccinations, and we're almost there. So, Mr. Chair, all I can say is thank you to everyone for what we've done to protect the NWT. Thank you, Mr. Chair.
Thanks, and sorry, I neglected Minister Green. Any closing comments?
Just thank you for having us. We're looking forward to providing the detail that you asked about on Monday in our in-camera session and sharing with the public later in the week. And yeah, that's about it for now. Thank you.
Great, thanks very much, everyone. And for everybody who's been watching and following on social media, very much appreciate your attention this evening, and good night, everybody. I'd ask my colleagues to stay behind as well. Thank you.